Now, I have some questions that either of you could answer. For example, the healthcare system in this country is near collapse. Costs are totally out of control. Is this internet social networking thing where people have better communications, does that ultimately do anything to address the heart of the problem, which is that the whole system is severely mismanaged? Will this sort of open communication help that?
I think so, absolutely. The shared management that is enabled by these sorts of technologies, by the web, by me having a mobile phone where I choose the applications that are relevant, where I can track how much I move, whether or not I take my medications, whether or not I'm having that pain in my neck, and should I see a doctor, should I find a hospital closest to me. This is giving us a new platform for choice and a feeling of control over our decisions on a daily basis. And then, once we get used to that kind of behavioral pattern of using decision trees, when something happens to us, God forbid, and we have to go into the hospital, we think automatically, yeah, why can't I use this? Why don't I have these choices? Why can't I access the web in hospitals? Why is that blocked? Why can't I get support to feel better from my friends on Twitter and Facebook in this setting? So I think we're headed that way, absolutely. And as Thomas said, it's going to be a tsunami when it gets here.
Do you think we need total new paradigms in the way healthcare is delivered in this country? Right now we have the paradigm that, the body is basically a machine, and if a part wears out or breaks, you get it fixed. There's not much emphasis on prevention. There's not much emphasis on the mental aspect of health, whether your mental state affects your immune response. Is that something that urgently needs to be developed more?
Yeah, I think those things that you mentioned, and I think the other thing that's essential is that the patient be given a role, and oftentimes be given the role of central decision maker. It's rather onerous to get our health information right now. To get results from our tests, for instance, if you go in and you get blood work, you have to ask oftentimes for your doctor to have the lab send you a copy of the report. That should be the default mode. We need to really shift the way we think about the patient's role in their healthcare. The patient oftentimes, the individual, oftentimes knows more about their health than even the doctor because they're the ones who are living with it every day. The opportunity is to extract that information and extract that expertise that we all have about ourselves.
Now, in the social networking sites that you're working on, would the doctors be a part of it also? So, for example, if I were under medical treatment for something and something changed, instead of having to wait for an appointment, I could just put a little message somewhere, which the doctor would have to look at because that's part of his job, and I could get a response without having to schedule a formal appointment.
That's trickier. I think there are several hopeful developments in medicine, in patient engagement, and in social health care that lead to some promise for that eventually being the case. Currently, one of the most promising developments that I see is that doctors and patients who aren't involved in the care process together are interacting on social networks. So we're already seeing patients, nurses, and doctors talking about general health issues. Now, doctors can't prescribe care via Twitter yet, but I'm hopeful that someday soon we'll find a way to pay doctors to interact with me on the web, through email, through text messaging, through things like telecare provided by Health 2.0 companies like American Well, and that when we incentivize doctors to interact with us in a safe and effective and clinically legitimate way, and when we incentivize patients and make it easy for people who are patients to use those channels to send this body of experiential knowledge that we generate every day back to our doctors, that's when we'll have true Health 2.0, true participatory medicine where patients and doctors are partners in care. And I think that's many people's ideal.
Right. And right now there's a problem with access.
Absolutely.
If you go to the doctor and he recommends something and you leave his office and you say, did he tell me to take 1 pill a day or 2? I can't remember. And I forgot to ask him that question I had. Yeah. It's hard to get back to him.
Yeah, and there's some efforts to provide that information automatically. So the Robert Wood Johnson Foundation has this great program that's called the Open Notes Initiative. And they're trying to make that the default mode, where when the doctor gives you advice, not just a prescription, but the general advice, that is written down and communicated. And that those are what should be very basic exchanges of information. But the fact is we need to put those into mandated procedures.
Now, there's a big issue in this country. It's a very big political issue about who's going to pay for health care and how much health care should be. Do you think that health care should be considered a right where everybody is entitled to receive whatever health care they need, whether they can afford to pay for it or not, or whether their insurance company is willing to pay for it or not?
Right. Well. So my personal opinion is that yes, I believe that healthcare is a universal right, and that access should be provided to all citizens. Now, I don't necessarily expect that to happen, as we've seen over the last year of the legislative effort to get that principle or part of that principle turned into law. That may or may not happen. I think the other component, though, the other essential component of healthcare reform or health reform is getting the patients involved and getting the patient to start making actions that can address some of these systemic concerns that we have with too much chronic disease, too much of our costs going to care for chronic disease. We can be changing those things on our own at the bottom grassroots level.